Hello and welcome everyone to our third session in the Peer Learning Forum, Collaborating for Success, Promoting Innovation and Equity Through Multi-Sector Partnerships. I am Ashley Klein from Prevent Connect, and I'm happy to welcome you all to this third session where we'll be looking at connecting communities and systems, promoting innovation and equity in multi-sector partnerships. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So throughout this forum, our objectives have really been to build a learning community through leveraging the practice-based wisdom of everyone that's been on these web conferences. We've also been looking at how we can balance creative risk-taking in multi-sector partnerships with the reality of needing to still show outcomes for the work. And then we've also been exploring considerations of equity. So who do we partner with, and maybe who don't we partner with? How do we partner, and toward what ends? So we will continue looking at these objectives as we go through today. And we actually want to start out with a text chat question. And I appreciate all of you who have been text chatting and letting us know where you're joining us from. Thank you for that. But we'd love to hear now about a recent success that you've had in your multi-sector work. So if you would go ahead and use the text chat to let us know, and it could be a relatively small success, or maybe it's a big one, something you've been working towards for a long time. Any success that you've had in your multi-sector work, we would love to hear and celebrate with you. And while we wait for you to do that, I want to go ahead and introduce our co-hosts for this series and this session. So please welcome Lisa Fougier-Parks and Ali Goodyear, both from Prevention Institute. Lisa and Ali, thank you so much for being back for this third and final session in our Peer Learning Forum.
It's our pleasure.
Thanks, Ashley.
Yes, thank you, Ashley. Thank you, everyone. This is Lisa, and it's a pleasure to be a part of this conversation. I've been a part of the Prevent Connect community for over 10 years now. And these are conversations and relationships and learning that I truly value. And I really want to appreciate you, Ashley, as well as Ali, who has put tremendous effort into putting together this experience for us where we get to connect with each other and learn together. We're also joined today by Tomi Nagai-Rota, who is our graphic recorder from Leapfrog Consulting. She's going to be helping us out by capturing our conversation visually. So thank you, Tomi, for helping us out today. So Ali, if you could talk to us about what we're going to do today.
Yeah, thank you, Lisa. So as Ashley mentioned, today's web conference is the third of the three-part peer learning forum. So this conversation, again, as the last two sessions have been, will be less structured and more organic and discussion-based. So we'd love for everyone to participate via the text chat, as the session will be a mix of open discussion and peer consulting, and also kind of some free exchange. So we'd really like all of the participants to jump in via text chat. We will be listening into a dialogue between two of our guests today, and sometimes that online model may feel a little bit like a fishbowl activity, or like you're listening in on a discussion between two peers. So we will be putting some text chat questions into the text chat box so that all of our participants can engage today. So with that, I would like to go ahead and introduce our two guests today. We are pleased to be joined by Jessica Walsh, who is the Director of Prevention at the Women's Resource Center in Rhode Island. Welcome, Jessica. And we're also joined by Tracy Helms, who is Empowerment Evaluator at the Michigan Coalition to End Domestic and Sexual Violence. So we're thrilled to be joined by both Jessica and Tracy today. And with that, I will go ahead and turn it back over to Lisa, who is going to get us started today by summarizing our first two sessions.
Can I actually take a moment to appreciate that Jessica's favorite mode of transportation is ice skates? My daughter's actually ice skating today. during her final days of summer break. Anyway, favorite food, Jessica likes too many, but in the hot summer, ice cream. There's an ice theme here. And her collaboration aspiration, Jessica, you aspire to maintain collaborations that prioritize resident voices and participation, and I think we're going to get to hear about that today. So thank you, Jessica. And Tracy loves playing Uno with her son, who doesn't love Uno. It's such a great game. Favorite food, pizza. I can see the party right now. And Tracy's aspiration is to build sustaining networks of people and organizations that create a united but diverse and inclusive voice to interrupt and ultimately end violence against women in our communities. What a powerful statement. So, just wanted to take a moment to appreciate the people that we're going to be connecting with today. So, yes, with that, I have the opportunity to do a little bit of summary of what we talked about in Session 1 and Session 2. And I would like participants and our guests to really listen to the summary and to think about, for you and for this community, what do you think are some of the most important outcomes of the conversation that you think have the most significance? Part of the opportunity on this third session is to do a little bit of synthesis and meaning making of all the various topics that we've touched on. So I'm really interested in hearing the meaning that you make of the conversations that we've had so far. So thinking back to our first session, and this session focused on what we were calling the balance between innovation and risk-taking and getting to outcomes. And folks talked about successes that they had in that and challenges that they had in that. Some of the lessons from the successes were about relationships, going to partners' tables, being transparent and authentic, and really focusing together face to face. Some of the successes in terms of the process of collaborating, again, this theme of transparency about issues like budgets and other resources, figuring out how to leverage partners' strengths, developing a logic model together, reinforcing shared vision and desired outcomes, and going through processes like training and practice on being allies. Structural successes, partnering with groups that are working on health equity, structurally working to maintain funding in ways like having people contribute and applying for joint funding like Noelle just talked about doing. People also talked about challenges, and there were some pretty real and significant challenges, and we tried to draw out what some of the lessons were from those challenges. And our community talked about needing to build in time to work through the challenges, needing to really bridge a lot of differences, even within public health practice, differences in the types of evidence that people were looking to, differences in credentialing and what were considered, credible sources of wisdom, different levels of emphasis on research or evidence-based programs, and different levels of emphasis on social justice principles being at the root of public health. There was also the need to figure out that right balance of joining together for joint outcomes and really staying true to championing the specific area that you were concerned about or bringing to the table. Some helpful resources were identified, connecting the dots document, Nitty Spaghetti, which is famous. It doesn't need any explanation. I'm just kidding. We'll actually compile these resources and make them available with hyperlinks and that sort of thing at the end of this to make sure that folks do have access to these great resources. Collective impact model, hiring and external consultants. Some resource needs were identified for funders. tools to help funders, to make the case to funders to support multi-issue initiatives and decrease the requirements to end up fostering siloed approaches. Resources for organizations that are working on issues other than violence to connect the dots between sexual and domestic violence and other health issues, including issues like substance abuse, mental health, HIV, STD prevention, that sort of thing. Practical resources for sexual and domestic violence prevention practitioners on some of this tricky stuff about how to build those bridges and navigate those challenges. And then also, the sort of need to continually onboard new practitioners and community members to the process. So how do we bring in newer individuals and also, really help folks who are transitioning from being more familiar with a more siloed environment to a more collaborative environment.
Great. Thank you, Lisa, for that overview of session 1. So we just wanted to pause here and take a few minutes to ask both of our guests, Jessica and Tracy, to reflect on what stood out to you as you heard the summary of lessons that Lisa just gave related to relationships, process, and structure. So Jessica, maybe we'll start with you if you don't mind just sharing a quick reflection.
Sure. Can you hear me okay?
We can.
Okay, great, thanks. I think from the first one, honestly, I felt like the challenges being faced by folks were so similar across the board, and really for our own work, it was just it's always helpful to recognize that folks are sort of struggling with very similar things. And then to begin the conversation around, creative responses. But for us, I think we're sort of knee-deep in trying to figure it out. So it was very validating to recognize that it wasn't just like we were completely messing up, that folks everywhere are sort of struggling with similar things.
Great. Thank you so much, Jessica. And Tracy, any quick thoughts that you would like to share?
Sure. I agree with Jessica's point. Just the eye-opener that, it's like social justice meets the world, right? As you go outside of, partners that you typically would collaborate with, there's a realization that everyone is not going to be so quick to jump on board the social justice train. And just, hearing that across the board does provide a certain level of, comfort that you're not alone, right? But also to that, I heard some very, what I thought, helpful tools, although we need more of them, but things like getting consultants or researchers or those people who can perhaps communicate in a way that's more in alignment with other sectors. For example, just sectors that are used to like kind of bottom line or evidence-based information in order to get on board, having a researcher to help communicate, what you're trying to accomplish, and that shared value is of value. And so while you're uplifting, voices of the youth, voices of, long-term residents, all of that's important, but again, knowing how to strategically use the right people at the right time is also important. So I would highlight that as well.
Great. Thank you so much, Tracy and Jessica. So now I think I will turn it back over to Lisa to kind of dive a little deeper into session 2.
Great. And folks who are participating by phone and text chat, feel free to share what stands out for you as well. And thanks, Mark. Mark comments that we usually try to determine what needs to happen to have an impact and then figure out how to evaluate our outcomes rather than do them in tandem and have it be outcomes driven. Let me read that again. We usually try to determine what needs to happen to have an impact and then figure out how to evaluate it. I see, rather than thinking about how to evaluate it and what needs to happen in tandem to really be outcomes driven. So thank you, Mark. Appreciate you sharing your reflections as well. So now let's talk about session 2, which happened a few weeks ago. And this session focused on considerations of equity in multi-sector partnerships. And we've organized the discussion in the same categories of relationships, process, and structure. So, it's interesting, different focus of the conversation, but I'll be curious to hear what stands out for folks as we review this in terms of what's similar and maybe what's different. So, lessons from successes. Participants and guests really talked about the need to make time for staff to discuss systemic and intergenerational oppression they have experienced. So to share those kinds of experiences with each other in our relationships. To share those experiences with each other to build our relationships. And to share and value the wisdom and lived experiences of ourselves and our partners. Also, in terms of addressing equity considerations in the process of building multi-sector partnerships, folks talked about engaging in capacity building efforts to help meet partners where they are and build the capacity to work together towards shared outcomes. People talked about building understanding together that addressing root causes benefits all of us. So really taking the time to do some discussion and education and building of some shared understanding. And also in the process recognizing that unlearning privilege can take different amounts of time and support for different people. And that, and that's part of the process. More lessons on process. Folks talked about in the process of addressing equity considerations in multi-sector partnerships, the need to support individual growth, organizational growth, and community growth and change. And people really talked about starting with individual growth, and I loved this quote, "Transparent introspection is a baseline. It's a starting place. It's a necessity." And that transparent introspection can lead to everything from rethinking the traditional partnerships that we're in to move towards building more strategic partnerships. It can lead to developing a more equitable base of trust, commitment, and buy-in from partners from which to create change. People describe the process of calling each other in instead of calling each other out. So there was a lot of talk of love and empathy and compassion and connection in this process. And because this is such hard work and very demanding, there was also discussion around the need to adopt practices, physical practices, self-care practices, and to institutionalize those organizationally. Structural issues. There was a discussion around the need to address historical trauma and structural barriers to participation in collaborative efforts, that there really are these very real symptoms and dynamics and structural issues that shape the degree to which people can participate or organizations can participate, and there's a real need to address those to make, I think there was sort of a discussion about equitable participation and accountable participation in collaboratives. There was a discussion around, part of that is really how do we structurally shift power to communities, and those people and communities who are structured out of decision making and out of access to resources. Part of our work of addressing inequity is how do we shift power to communities in structural ways. some people, there was an example that was shared of developing a theory of change around the work that really embedded equity considerations, and from that theory of change, a decision screen to do everything from delineating values and what might be considered the North Star destination of where we're trying to go in the work. The decision screen was used to support organizational reflection and decision making, to make decisions about time and financial resources, and to influence organizational policies and directions. Again, there were lots of challenges that were raised, and tough stuff and lessons from those challenges. Acknowledging that implicit bias exists and understanding that it's going to be expressed in our collaborative work because implicit bias is built in, it's systemic, it's not individual. So we need to acknowledge it and understand that it's going to be there. Another quote that I loved, develop relationships where trust can rise to the top, that there are going to be these challenges, but in those challenges, do we have the kind of relationships where trust rises above and rises to the top during those moments? Can we be skillful in creating spaces that are mindful of power dynamics? Can we apply trauma-informed principles to our partnerships, meetings, etc.? For example, the notion of community agreements. And can we skillfully challenge people's biases and misconceptions about the roots of problems and about communities? And when we're facing those challenges, can we keep coming back to the group to as the place for solutions? And can we stay solutions focused? So those were some of the ideas and lessons that came out of the difficult challenges that people mentioned. In addition, as folks talked about moving the work from the personal and interpersonal and organizational into the interorganizational and into the broader community, how to set expectations around coalition engagement and hold each other accountable in the work. How do, I think, as was said earlier, how do we take our organizational values like social justice and share them with our partners as values that are really important to guiding our work? And sometimes that does mean restructuring partnerships to better align with values and better align with our strategic direction. And it definitely means that in the work that we do in our coalitions and our partnerships, moving away from a traditional one-size-fits-all approach, this is how it's done, this is the way we have to do it, to really adapting the work and fitting community context. Lots of helpful resources were mentioned. Move to End Violence, concepts like liberation of the last girl, centering solutions, and working towards collective liberation. Again, the notion of a theory of change and a decision screen to guide the work, community agreements, and of course the wisdom of community partners as helpful resources. And resource needs were also discussed. There was a request for more training like the work that Move to End Violence is doing to continue to cultivate shared language and intersectionality within the field and the movement. And then also, more tools and resources to assist folks who are addressing issues of implicit bias and other equity considerations and group dynamics, and really needing to, receive training and guidance and support on how to do that live in real time.
Great. Thank you, Lisa. So now we'd like to transition back over to our guests and hear a little bit from them. So Jessica and Tracy, what are some things you've learned about how to address considerations of equity and multi-sector partnerships? And we would also like to invite and encourage everyone else to participate via text chat to share their thoughts on this question as well. So Tracy, maybe we'll start with you if you'd like to share a quick reflection.
Sure. Couple of things come to mind. One is that I like the stages of change because I think we all come to the table at different points of readiness. And when you're diving into anti-oppression work or intersectionality, understanding how you can be both the oppressor and the oppressed, how you process that is going to kind of directly relate to how ready you are to receive that. We are doing similar work here in Michigan with introducing intersectionality to a lot of our DVSA agencies as a way to kind of broaden their perspective on their messaging, their policies, their practices, their procedures. And, you know, there are some people in the group that get it right away and others that will make the claim that that doesn't pertain to their community because they don't have that particular characteristic reflected in their community. And so it really is about, you know, assessing where people are and how ready they are to receive that information. So that stood out for me, and as well as creating the trauma-informed learning environment. As we push forward with our initiative to incorporate intersectionality in all the work that we do here at the Coalition, all of our trainings and whatnot, as we go outside of our usual audience, and even sometimes within that audience, I think something needs to be said about the continuous need to check our own biases or the fact that we haven't arrived. And I say that because, you know, when a person in a training says something that is not informed or that is very rooted in traditional values, those of us that feel like we have some level of enlightenment or awareness, you know, how do we support that person's movement through those stages of change? How do we support that and not become punitive, you know, towards that person because they may not be there yet? So I think that's also important when you talk about creating a trauma-informed learning environment. And, you know, that would lead to better success of moving people along those stages of change than not.
Thanks, Tracy. Thanks for sharing those thoughts. Jessica, anything that you would like to share at this point?
I think it sort of had me thinking about that so many of our systems, and it came up in some of the review here, is a lot of our systems are basically not designed for innovation or for genuine cross-sector work, and that we really have, it's a struggle not only against internal things that we have to, you know, dealing with our internal biases and privilege and all that, but it's also that there's just these really practical, logistical things that are so much harder because our systems aren't designed to work this way. And so I think that there's this like really internal, really hard work to do that is very important, and it's really frustrating that then there are these sort of things that are almost false barriers. They really shouldn't be barriers, and that we're going to have to work to sort of shift practice to be more responsive and realistic for cross-sector work.
Wonderful. Thank you, Jessica and Tracy, for sharing those thoughts and getting us started today. So I think we're about ready to transition into our next session today, which will really be around peer consulting, around successes and challenges. in multi-sector sexual and domestic violence prevention work. So Lisa, I'll turn it back over to you.
Great. So now we have an opportunity to go deeper and further and continue to build on this conversation. And we've really organized it around the theme that I think in some ways bridges both the conversation from session 1 and session 2 to talk about how do we connect community systems. And that in many ways, promoting innovation and change and equity through multi-sector partnerships is really about connecting communities and systems, or that there's a very strong theme in the work that is really about connecting communities and systems. And so Jessica today is going to share with us some successes and challenges from her sexual and domestic violence prevention work that I think is going to touch on this theme or topic for today. So we're going to ask Jessica to go ahead and start with sharing a success from her work, and we will also periodically put out some text chat questions for participants to engage with one another and with Jessica as she proceeds. So Jessica.
Great, thanks Lisa. So as the Delta folks on the call know, we have been encouraged with the latest iteration of Delta, the Delta Focus funding to address the social determinants of health as a domestic violence prevention strategy. So in Newport, we decided to focus on increasing youth social cohesion in a neighborhood that is referred to locally as the North End. And we chose that because increases in social cohesion have been linked to decreases in dating and domestic violence. So we were engaging in assessment and transitioning to this place-based work when the Rhode Island Department of Health released an RFP for place-based projects designed to reduce health disparities called health equity zones. So although we were a non-traditional applicant, thanks to Delta, we had both the community connections and the base of knowledge to develop a competitive RFP, and we were awarded the funds. And our Delta-funded youth social cohesion work continues within the larger umbrella of the HES. So I just wanted to give that quick background because the success and challenge I'll be talking about today are related specifically to the Health Equity Zone project. But I wanted to be clear that we really see it as an extension of our Delta work, and the Delta work is sort of the foundation that made the Health Equity Zone even really possible in our community. So the Newport Health Equity Zone is a citywide coalition mobilizing residents and resources of the Broadway and North End neighborhoods to make Newport a place where everyone can thrive. We envision a city where structural, financial, and environmental barriers to health and well-being are eliminated, where public policy fosters the good health of all residents, and where residents feel empowered to control the health of their families and their community. So the success that I wanted to share today is related to multi-sector collaboration. Is simply that we were able to create a multi-sector collaborative, but that we created one that also includes residents as equal partners. So our organizational partners represent open space, arts and culture, biking and active transportation, food security, youth services, the maker movement, educational innovation, and local neighborhood associations. We have ongoing support as well from the Housing Authority, from the school department, and local government. And what we really feel, so simply bringing all those folks to the table, I think partners who've been doing the DV prevention work for a long time especially can appreciate it felt like a huge win just to get open space at the table, for example. So we have this great collaborative, and then we've also been able to we have a dozen resident consultants who are paid to participate as leaders and advisors on the collaborative. So having residents and organizations participate as true equals is new to our community, and we're proud of this success.
Great. Thank you so much, Jessica. So Tracy, this is the point where we will have you jump in with some of the peer consulting questions for Jessica.
Okay. So Jessica, I mean, it sounds like a wonderful initiative that you all are embarking on, and the fact that you were able to get residents engaged is great. So I was wondering if you could tell us a little bit more about, you know, how did you even go about the recruitment process, making sure that you had, I don't want to say the right residents, but residents that were a good fit for what you wanted to accomplish?
So it's a really good question, and I feel like I don't have a great answer because we say every day we don't know how we got so lucky. So we wrote into the first year of the grant that we wanted to pay residents to participate in the project, and we just circulated a job description. So it's only it's 10 hours a month or less, so it's not, you know, a ton of hours for folks. We circulated a job description. We had, I don't know, maybe 15 people apply, and we ended up inviting all of them to be part of the project. And a couple had decided over the time that they couldn't fit it into their schedule, so we're down to about 12. But honestly, every person who came, we thought really brought something unique to the project. So on one hand, I think we were lucky, but what I also think is that what I've been reflective about is that there are so many residents who really want to be engaged in their community but don't have, you know, an outlet that is truly meaningful, and that by simply providing that, there's maybe it's not that we were lucky, it's just that there's tons of people in the community who are really interested in being a part of things. And so I think that that's definitely part of it. And I also think on our end, our expectation was simply to find residents who had some level of interest and could bring whatever their expertise was to the table. So if we have an open mind around what is expertise, and if it's simply, you know, living in the neighborhood and understanding the needs of their neighbors and what's great about their neighborhood and what needs to be worked on. So maybe it's also that open mind. But I will tell you, we have a range of ages. Our youngest resident is 18, and our oldest one we have 3 seniors that are, you know, participate. We have different racial representation. We have both men and women. So we really did end up with a diverse group. So there was definitely a bit of luck in there.
That is awesome. I mean, just the diversity, like just, you know, and the collaborative work that comes out of that is probably amazing as well. I mean, even with the different facets of the project that you've listed for different people of different interests to, or with different skill sets to see where they fit in is even great. And so with all that diversity sitting all at one table, much like the topic in our previous webinar, you know, what rules or processes did you put in place to create a space of equity between, you know, the residents and, you know, the diversity within the residents, and then even just the residents with, you know, agency reps?
Yeah, so it's been a learning process all along for sure. So initially, we actually didn't have folks meeting together, and that was a very strategic decision. Our past experience had indicated that we wanted residents to feel really confident about how much we valued their being at the table and their expertise that they bring to the table, so that there would be a comfort level in really pushing back and standing up when they were dealing with organizational folks. We also strategically chose small grassroots organizations as our initial partners because I wanted folks who would be able to see residents as equal partners with fairly little prompting and coaching. And so we were really strategic in terms of who we brought to the table to begin with. And we also set out principles from the very beginning. And one of the principles is that this is a resident-driven process. Another principle is that everyone brings something to the table. And that sustainability will come from building community capacity, not from funding, essentially. And so that our principles and our process was designed right from the beginning. And so we continue to have both meetings where organizational folks and the residents are together making decisions. We also continue to support residents in monthly meetings that are just for residents. And our reason for doing that is that we want to make sure that they're comfortable in all these processes, and if there's something going on that we need to address as the backbone support agency, then we want to hear it, and we need to build those relationships. And so that actually wasn't in the initial plan, but we realized kind of quickly, you know what, we need to be bringing residents together. It also allows them to build relationships with each other. And so we have a process that values everyone, but also recognizes that we have to set our table and norm our process around residents because organizations go to meetings every day. They can adapt much more readily and feel comfortable in a lot more settings. And so we have to norm every process around residents, and that's what we've tried to do throughout. But it's definitely not without challenges. And I wonder sometimes, are residents really telling us things that they're uncomfortable? Are they really pushing back? I mean, we see some pushing back, but you always question how real is this, right? You know, how real are people being with us? But you can only just ask the questions and try to be as open as possible.
Great. I think your strategy was very smart in terms of, like you say, building capacity within the residents group, and building up their capacity to push back and have their voice be heard. So I think that was a very smart strategy. I guess I'm curious to know what. Well, it's kind of either what or how do you think your organization, or even yourself and the others on the project, played a role in the success? And I kind of mean in a way of like, what was your relationship like within the community prior to this project? And do you feel that relationship contributed to the success?
That's a really good question. So in terms of our relationship with partners, so we didn't have a super strong relationship with residents prior to this project. The relationship with the partners, though, I think was key in that, the folks we brought to the table were all folks we had worked with who were willing to take the leap of faith with us because we had proven through other projects that we may do things in a slightly quirky manner, but we tend to get the outcomes that we set out to get. And so we had sort of built trust and willingness among our sort of key lead partners to kind of go along with our idea. And we also we engaged those partners with the writing of the proposal and the designing of the process so that we had buy-in around the resident-driven component before we even were funded. So beyond that, I think it does help to be all DV organizations, I think, have a empowerment sort of mantra and culture. And so within the organization and within how we think about our work, the idea of empowering residents isn't so outside of the norm of what sort of we do with clients, say, every day. And so I think there was definitely a mindset that enabled us to kind of just transition to, it's totally different than a client relationship for sure, but there's that piece of empowerment and the idea that folks should be the experts of their own lives and the leaders of their own lives, that really translates well into community work. And I think that allowed us to really quickly build trusting relationships with our resident consultants.
Thank you, Jessica.
Thanks.
This is Lisa, and this has been such a rich conversation. Really appreciate the depth to which you're helping to facilitate the conversation. Tracy and Jessica, thank you so much for sharing your wisdom. I know I'm getting a lot out of it. And so there's been some good text chat, and I wanted to bring that in at this point. There have been a couple questions, so Jessica, I hope you'll be willing to field them.
Sure.
And just kind of see what your reactions are. First question is, are there Newport Has T-shirts? I think there are folks who would like Newport Has T-shirts.
Well, I have to say we have our local makerspace as a partner, so we could have Newport Has T-shirts by like tomorrow. I just have to ask, but no, there currently are not, and it is very flattering that anyone might want one. We have a fantastic logo, though.
I think you have some fans. Yeah. Another question is that there are principles apparently that guide your work, and I guess Noelle has not been able to find them. Are those?
Sure.
Do they exist? Are they accessible?
Yeah, I don't know that they're on the website, Noelle, because they're sort of an internal working. They're sort of our internal working agreements, but I'm more than happy to share them. I don't know that there's a way for me to share them with the whole group right now because it's not like it's a link, it's a document, but if somebody can let me know how to share them, I can do that.
Yeah, we can. I'm sure we can figure something out.
Okay. And Noelle, I can just email them to you directly, but if anybody else wants them, I'm happy to share.
So also looking at the text chat, people are really appreciating that you pay residents who are involved with the work, and that you value their expertise and time and skills and contributions. And it sounds like multiple ways, including through money. People are also appreciating the discussion around healthy resistance strategies or pushing back or advocating to leverage your own power and privilege to create more balance and power. And there's a notion that this in some ways might feel like a tightrope walk. Where there's some kind of balancing and navigating from moment to moment that might need to happen in order to continue to move forward. So I don't know if you have any reactions to that analogy or other thoughts about, the kinds of dynamics that you were talking about.
Yeah, I think to the first comment about paying residents, it's actually, we feel like we're all paid to be at the table, so they should be as well. But I will sort of be transparent that it has not come without resistance. So some partners at first didn't understand why we were paying residents. And so we really had to bring people around to that idea. We also provide child care whenever folks need it. And what we allow is actually we reimburse people to pay their own child care person, which is different, but it also is what our residents are most comfortable with. And so, but all of it comes with challenges. And so just simple things like we had to put every resident consultant on the payroll because normally you might pay them as a contractor, but then there's tax implications for them, and we didn't want to have to deal with that. And so there's both systems like challenges in trying to do things differently, and also partners who didn't really understand why would you need to pay residents. And it's really about equity for us, and also that it's what makes it possible for some people to be at the table, and we wouldn't want that to be the reason that folks couldn't be here. So I appreciate that folks recognize it, and I just think it's been a challenge, and also I feel like quite necessary, and all of it's able to be navigated. And the tightrope comment is just, and Noelle, they are actually on the agency payroll. They're on our agency's payroll. I see you asking a question about the stipend. Yeah, they're on payroll. They are all employees of the Women's Resource Center. So in terms of the tightrope, that is like exactly what most days feel like here. One is we, like as myself and my colleague that really manage the project, feel like we need to be the voice of the residents when they're not in the room. So there's meetings when residents aren't there. But you don't want to be paternalistic or condescending or assume that you know. And so you're constantly walking, the tightrope of are we staying true to our principles? Are we really upholding residents? Are we keeping them at the center of this process? And then the second piece is that we have funder obligations and partner obligations, and every step of the way it feels like we are pushing back and trying to encourage folks to be willing to think differently. So we're required to offer a diabetes prevention program, for example, which is not at all exciting to me, but it's part of the requirements. And we convinced the health department to allow us to hire residents to be the leaders of those groups. And that seems like it should have been simple enough, but just the structure prior and with everyone else is that it's an organization who offers those classes. But we really are committed to building capacity of residents, and so we saw this as one opportunity to do that. And they're doing a fantastic job, and they are really excited about running this program, and they're learning a lot, and they're really improving their community. But every step of the way, you look at every requirement and every funding opportunity, every decision, and you have to ask, how can we bring residents to the middle of this? Like, how do we make sure this is done in a way that residents feel is empowering and inclusive? How do I not forget that when we have 14 million questions coming to us every day and we have to respond? So I appreciate that folks recognize it's a tightrope, but we're happy to walk it.
Thank you, Jessica. This is Allie, and I think that this might be a great time to go ahead and transition into the challenge portion of the conversation. So Jessica, would you like to go ahead and share your challenge with the group?
Sure. So, we're just, we started talking about a little bit, we are struggling with the balancing of the external expectations and systems with our commitment to be resident-driven. And so related to collaboration, we are struggling with onboarding larger, more mainstream partners to the collaborative. So for example, the hospital or our local community action program is a really big agency, the school department. We've set the table for residents, and so the larger orgs in particular seem to be struggling with sort of how to show up at the table, and we're struggling with how to integrate them without compromising our commitment to residents. And so we've definitely been angering people inadvertently. People are really uncomfortable, or they feel like they're being left out of the process because there's a certain amount of privilege that comes along with being larger scale organizations that tend to be at every table. And so we're struggling with that.
Thank you for sharing that, Jessica. And Tracy, would you like to go ahead and jump in with some questions for Jessica?
Sure. So Jessica, with getting more of the, like you said, the mainstream or larger partners to the table, would you say that finding that shared benefit or being able to communicate the shared benefit in quote-unquote their language has been part of the problem, or what do you feel is at the crux of the problem?
That's a really good question. I mean, I think part of it, honestly, is I think the crux of it is these are folks who are used to directing processes, and now we are asking them to participate in a process that is directed by residents, who for many of them are clients. And I think that shift in power dynamic is really hard. I think that's really sort of at the center. So folks think they recognize that they want to be at the table, that they should be at the table, but when we aren't inviting them in the way that they're accustomed to being invited, their feathers get ruffled and people get upset, and we also need to make sure that residents won't be silenced by bringing on some of these bigger partners. I hope that answers your question. It's really tricky.
Yeah. Sometimes until they see the benefit of perhaps their bottom line or how they get, recognition, that they're, or just stepping into, like you say, a different role, I can see how it continues to be a challenge. What is it that you think you would need to help move them, like in an ideal world?
Yeah, I mean, I think maybe what you just mentioned around if we could identify like what the benefit is to them in a way that is both real but also sort of focuses on why being part of a resident-driven process is beneficial to them. And I think that's a hard thing to define. So maybe trying to think through more, how do you help these larger players recognize being part of a resident-driven process is valuable? And that they don't, so the thing that comes up is really people think, well, we know better. And it comes from a good place. It doesn't come from like wanting to be, I think people really genuinely believe that they know better. And so it's hard to help shift people's thinking, but I think you've sort of already hit on it, which is how do we come up with what's in it for them?
In terms of social cohesion, which youth social cohesion, which is part of one of your outcomes, are you finding any difficulty like measuring that or demonstrating that in a report or some of your findings, like in terms of just that kind of hard evidence to say that what we're doing is successful?
Yeah, I think it's such a good question. I think that definitely we are still early in our process, so most of the data that we have is qualitative and process-driven rather than outcome-based and or quantitative. And so I think we're still early to be able to show the sort of, hard data that may move them. Now I think we have, and it's just a tricky position to be in. Because I think the things that move us, like residents saying, this process is so different, I've never felt so valued. People are saying really great things, but it doesn't necessarily sell it to somebody who isn't already believing it's a good idea. And the other thing that's happening sometimes is that people are like, well, the HES, so we get all these requests, like, we need resident input, so we'll just go talk to the HES. And our thing is, we can't allow other processes and organizations to tokenize our residents if you're not going to really bring them into your process. And so what people want to be able to do now is just be like, oh, check, we went and talked to the HES, and now we have resident sign-off or buy-in on our process. So we're saying no to a lot of that, and we're trying to help build the capacity of organizations to genuinely engage residents in real ways. But it's not really related to your question, but it just came into my mind as one of the pieces that, even if people recognize that it's valuable to have a resident-driven process, I feel like I'm seeing people sort of willing to say, oh, they've got that, so now we don't have to bother, which wasn't what we were hoping would be the outcome. In terms of, because we also think that more organizations need to begin to bring residents into the center of their work if we want to see true structural change and decreases in health disparities.
Well, Jessica, I really applaud you all's efforts to what sounds a little bit like fidelity, but just a bigger piece of just being advocates and just staying true to the residents, understanding that power differential and in the face of others wanting to kind of, take the easy way out. You guys are sticking to, you're just sticking to your plan, and I really applaud you for that, because it could be easy to stray away from that in an effort to, get other kinds of partnerships. But, like you said, you're saying, no, that's not our intention, and we will remain to make sure that our residents are in the forefront of this. So I applaud your effort on that.
Thank you so much. Thank you.
So this is Lisa again, and again, very skillful interaction that I'm really appreciating. So thank you, Tracy and Jessica. I'm tracking the text chat, and I have a couple things that I thought I'd bring up. I also have a question myself, and I think Well has also added something, so I'll take a look at that. And folks who haven't chatted recently, please feel free to go ahead and make any comments about the challenge that Jessica was exploring with, that Jessica was exploring with Tracy, or any comments or similar experiences or insights that you might have. So Jessica, one of the comments that was made earlier in terms of this notion of a tightrope was that sometimes perhaps, just as we need to challenge or, push back on our systems powers or our institutional partners, perhaps there are also times when we need to, offer a little bit of pushback or, different perspective to community or neighborhood residents as well, and that might be in encouraging to them to think through, their potential directions, or and how that might relate to their goals that they are trying to achieve, or whether or not they are considering or accounting for other voices or interests in the neighborhood that need to be considered or accounted for. So I'm wondering if you've ever had to navigate that and what that might look like in your work.
Yeah, I mean, I think we definitely, so there's a couple pieces. We have these 12 residents, but we also don't rely on them as the only feedback. So we have built into our process a couple, we call them feedback loops. And so, for example, when we did our needs assessment, the residents and the organizational partners designed the assessment. They decided what questions they wanted to ask and how they wanted to ask them, and then we kind of ran around and did the assessment. When we got all the data, we then hosted what is called the Creativity Lab, and we invited the broader community to come in, see the data, tell us what we got right, what we might have missed, and offer some ideas for how they would like to see these challenges addressed. So that brought in a much bigger audience from the community. And so when we have to make decisions with residents, we really haven't had to push back that much, honestly, but when we do, we often say to folks, this isn't just, like, we have to remember that these residents and our role is also to consider and bring in the voice of the larger community. And so we have all this data and we have all these ideas. And what I find is that folks really take that role seriously, that they are representing a community and they want to make the best decision on behalf of the whole community. And so the biggest pushback is actually usually when, like, our funder changes what they can fund and we have to go to, or there's an idea that we simply can't do right now because for whatever reason it's just not feasible, or we don't have the funding, or something changes, and that is hard. But we just are really transparent about what we are able to fund per the requirements of whatever grant, the big grant we have. But then we also are constantly writing for smaller ones to be responsive to the community. But we just have to be transparent with people and say, like, we can't do that right now. We're going to keep it on the list. So we have had, I think, again, maybe we're just lucky, but I think if we really, residents are really not that different than organizational partners. They understand that we're all operating within a system and that we have to be willing to compromise. We had a huge shift midway through last year where we actually pulled the group together and talked about walking away from the funding, which is $400,000 a year. So it's a big, it's a big amount of money. But they, the health department had changed the expectations to such a degree that we felt as a backbone that we did not have the right to commit to these new expectations without bringing the residents and the entire collaborative into the decision, because the new requirements really kind of compromised our principles and the commitments we'd made to the residents and the community. And so we just decided as a group, are we going to jump through these new hoops or are we going to walk away? And by framing it as a choice, which it was, everybody said they wanted to jump through the hoops. Let's meet the new expectations. It also created a sense that this entire team, including the residents, understands the position that we're in, and we're very willing to think creatively with us on how to make these new expectations fit within the vision and the long-term goal of the community. And so I think it's really about just transparency and not assuming residents can't, like, wrap their mind around these things or be reasonable, because really most of the time residents are the easier ones to deal with in our experience.
Okay, thank you for that. And then I had another question, and there's a lot of comments that I want to make sure to get to as well. So you said that, and it sounded like the exchange was a little bit helpful in reframing your challenge a little bit, and that perhaps the challenge is how to help the mainstream partners understand the value and the necessity of resident leadership and the resident direction. So my question to you is, imagine that that challenge was addressed, or you were able to meet that challenge. What would that look like? What would success look like when, if you imagined that your mainstream partners really do value and understand the value of resident leadership and direction, and what would be different, and how would they act differently?
That's a really good question, and I should think about it every day to keep us focused. But I would say for us, if we had these larger organizations who are already offering lots and lots of programs in the community, if we had them on board and really committed to a resident-driven process, then we would have much more equitable health outcomes in our community. One of the things one of our mantras, we have many, is that we don't need more programs. We need to be more strategic with what we have. And really what our residents want to tell and work with these organizations around is, they see the value of, obviously we need a hospital, and they just want the hospital to be more accessible. We need the CAP agency, and there might be just some different ways that the agency could maybe do their work that would be more responsive. And so I think it isn't about anybody not being at the table. It's about just creating a much more equitable table. And I think ultimately the community would be a healthier and happier place to be.
Thank you. Thanks for thinking that through. I'm going to just read the comments that have come in. There are a lot of them, and I'm going to kind of try to group them together, although since it's a lot, I'm not sure if I'm going to do this successfully, but I'm going to go ahead and read them so that we all have the value of our participants' thinking and questions, and then I will ask you, Jessica, to just kind of, share some thoughts and reflections that come to mind. You probably won't have the time to address all of them, but at least we'll have the value of hearing them and have you react to them a little bit. So Noelle says that the analogy she uses is the parallel of training folks to be victim-centered with safety planning, such as asking the question, what is your biggest concern or fear, and meeting victims where they are where they are with that, while sharing other information we might have to help inform a victim's risk analysis. So the question for the community is, what is your biggest concern or fear? And then supporting them from a similar empowerment advocacy model. And just to clarify that engaging with community residents needs to be strengths-based, but if they do bring up a need or fear, we need to follow that direction. And Beth shares, we are dialoguing about community-based versus community-placed, and then going back to a readiness assessment to identify who really wants to do the work, or if this is a priority. And by this, I'm guessing, well, let me not guess, let me just read. Also, we also need to give up, quote unquote, making them fit into our agenda. Thinking backwards, we really need to not apply for a grant until the relationships have been established and the priorities have been set. And Carol shares that the facilitator of the council are encouraged to have an entire meeting centered around this. Carol's talking about some youth-adult partnership work. Youth and adults sitting together discussing what's the old norm and how to change it. And it helps the youth provide support to adults who, quote unquote, slip, as well as vice versa. And Carol also comments there's a chicken and an egg issue around some of what folks are bringing up. The question being, how do you establish a group before there is funding to support a group too? So those are some of the comments and reactions, and there are others as well, but I thought I can stop there. And Jessica, just see if you have some, any kind of reactions or thoughts that you want to add.
Yeah, I think that the idea of community-based versus community-placed is so important, and also this idea of it being a chicken and egg, it's been an internal struggle for us. So I just want to sort of uplift what Carol says as it being very real. And so we wrote this grant without the permission of the community, and we balanced that with our commitment to a process where we would bring them in right away. And sometimes I feel like it's really hard. There's not, and we were lucky. Our health department had a really, really innovative RFP that allowed us to do that. But we had to just make, and it's part of why we remain so committed, because really writing the grant without resident permission is sort of not in keeping with what our ultimate goals were, but we felt like it was important to do in order to get, because you have to start somewhere, and we needed some funding in order to be able to start. And so that's what we did. And but I think it makes us feel even more accountable to residents, because we committed from the beginning that if we're going to write this, we're going to have to really stay true to our principles throughout the process. So thank you, Carol, for that, and I just think there's not an easy answer.
Well, thank you for those reflections, Jessica, and you're getting lots of appreciations and agreements and applause. So I hope you're checking that out. So we have a few minutes left. We have about 9 minutes left in today's conversation, and we wanted to give both Tracy and Jessica, as well as all of our participants, the chance to do some reflection and some wrapping up. So we have some questions, and you can answer, whatever is calling for you to respond to in this moment. And maybe we'll start with you, Tracy. If you can, some of the questions that we have as we think about wrapping up this discussion and wrapping up this series of peer learning forums, what's really rising to the top for you as a key takeaway or implication for the field and the future of sexual and domestic violence prevention? And if in addition to that you have any thoughts about resources, it's always helpful to pull out resources that you think could be helpful to others, or resources that are missing that you think that we should create together, or someone should create, or that we need to create in order to be able to continue to strengthen the work and move forward. So Tracy, please go ahead and share your thoughts.
Thank you. First, I appreciate the opportunity to be able to question Jessica and her work, and this was a great experience overall. I like this format. I would say that my takeaways is that you have to be strategic. You have to really give some thought into how you want to approach the work to make sure that it's equitable, to make sure that you have the right people at the table. And so, as you think about, going outside of your comfort zone and pulling non-traditional partners to the table, really looking at perhaps their mission or their level of readiness, and being strategic about that, just even the forming of, your coalition or collaboration. Also, taking the time to build capacity. I think if, you shortchange your outcome if you shortchange that process of building capacity, whether it be, stages of change for you as an internal organization, or with the people that you're working with externally. You have to take the time to build capacity. And also we have to continue to search for tools and ways of helping our funders understand the value of intersectional work. I don't think there's enough of that, and we could stand a lot a lot more of that. And part of that is, uplifting the value of, practice-based evidence, those qualitative type responses in the work that we put forth. I think that's important in these other areas, including public health, who rely heavily on evidence-based research to make decisions. So that's what I'll say in all.
Thank you so much, Tracy, and thank you so much again for your very thoughtful insights and very thoughtful peer facilitation today. So back to you, Jessica. Here's your opportunity to respond to those same questions.
Sure. I just first appreciated, my first reflection is that it's always good to have critical questions asked. So I don't really know that that's responding to a specific, reflection question that you posed, but I think having critical questions just really helps us to always continue to, improve what we're doing. And then I saw somebody mention that, it's, brave to be really transparent, and I think what I was reflecting on just in the end there is that transparency throughout a process is really freeing. And so I didn't say anything today that we haven't said to our partners or our funders, and I think that makes it, I don't know why people aren't more transparent, quite frankly, because it makes life a lot easier, and it allows us to talk in real terms with folks. And so I just appreciate that I'm in a place and with a funder and that where that's acceptable. And I just, I really am going to go back and look through the text chat when it's published to us, because I feel like there's going to be a lot of good ideas in there that we can borrow. So I appreciate all that as well.
Great. And I'm looking at the text chat and what folks are saying, and there's agreement with the need to build capacity, the need to not only build it but to sustain it. So that was a takeaway that resonated, and we still have a few minutes left, so other folks who have participated today, if you want to share your key takeaway or your final thought, please feel free to do it. This, I think we can actually move to closing remarks and wrapping up the 2016 Prevent Connect Peer Learning Forum. So, as we're wrapping up, as you can see from this visual that Tomi has created, it just looks so rich and complex and really reflective of the richness and the complexity of the work that we all do. And so I'm leaving today with with a couple thoughts of, how do we share this practice-based wisdom? How do we take this conversation and help share it in ways that others who may, as we started today's conversation, think that they're the only ones who are struggling with these same challenges? How do we share this experience that probably many can relate to, or these experiences that many can relate to, and support others who are perhaps feeling isolated? So that's one question that I have, and I would love to hear folks' thoughts about how to do that. And I also want to express my commitment and Prevention Institute's commitment, and I am sure Prevent Connect's commitment to taking the richness of this conversation, pulling out the resources, and making that list available to folks. And yes, Mark, definitely getting a copy of this beautiful, beautiful image and capturing her conversation, making that available, and trying to give, the wisdom here legs, so to speak, so that it can continue to, have benefit and merit in the world, to strengthen our work and to connect each other and to help make our communities safer and healthier and more equitable. So with that said, I want to appreciate everyone's participation. So many people contributed to this series, and it was truly, truly a community effort. And so thank you, everyone. It's been a real honor and a humbling experience to have been able to help facilitate and create this container for the learning. And we are happy to also be wrapping it up. So with that said, it's 12:30, and this concludes today's Peer Learning Forum. And Ashley, I don't know if you want to say any final wrap-up comments. Thank you, everyone.
Sure. Well, I just want to thank you, Lisa and Allie. Thank you, Tomi. Thank you to the guests that we've had over these last 3 sessions. And Tracy and Jessica, thank you. Thank you all for participating, for sharing your wisdom. We will be making all of this available on the Prevent Connect website, and I will send an email out when it's all up and ready for you to access. But thank you all so much. We hope you've enjoyed this forum, and we look forward to the next one. So have a great rest of your day. Take care. This concludes the session today.